Hey, cat. What's up, girl? What's up, girl? Nice to see you, Pie. That's a good girl. All right. Let's see. All right. All right. Out here with my two favorite mares today. For those of you that have been watching my lives or my TikToks for any amount of time, you will recognize these two ladies. We got Kat here, who's the gray mare. Good morning, Jose. Hey, good morning, Cindy. These are both barrel racers. Kat's probably my favorite, but don't tell Marilyn. She's kind of back there watching and listening. Hey, morning, Kaylin. So we're gonna get going on these girls. Kat is in the middle of breakfast, so hopefully she's not too pissy at me for pulling her away from it. She's usually a sweet mare. Doesn't really get pissy about a whole lot. She was recently beat on by that girl back there, and so she has a little muscle tear apparently in her right shoulder that's healing up, but she's still running just fine. So we've been given the green light to go ahead and adjust the shoulder, not worry too much about it, but I'll still be a little bit careful because of the fact, hey, we're gonna wait for breakfast for a minute. Whenever there's a muscle tear or a known soft tissue injury, you obviously want to be a little bit more careful. She got bit on her butt too. Jeez, Marilyn kicked her butt. Good morning, Winslet. Yeah, she's a beauty, man. Her personality matches her look. She's just the sweetest. Oh, she's the sweetest thing. Whenever I pull up here, both she and Marilyn just come hang their heads over the stalls. And, oh, she's a love bug. Oh, love this girl. She's really made me love the grays. Everybody has like the stereotype about the red mares, which, for the most part, it's pretty accurate. They can have bad attitudes and be a little fiery. They can be sweet too, but, they have a stereotype surrounding them for a reason. It's kind of earned. But these grays, man, they're like the opposite of the red mares. They're just so sweet. Whenever I pull up and see a gray mare, I'm like, oh man, it's going to be a good one. And she kind of started that generalization for me, just because she's always been so good. She's had issues in her shoulders in the past, and so when I bring her legs out to stretch them out, which you see, she kind of pulls away and starts to get fussy with me about them. But she's never nasty. She just kind of pulls it away. Whereas some horses, if they're hurting and you go and mess with that part of their body, they can try to bite or kick or paw at you. And she's just always so chill. Oh, girl. Go. A little touchy on that SI joint. Let me check the other side too and see how she's feeling. Yeah, so she's called a flea-bitten gray. That's what those spots are. She's a flea-bitten gray. Hi, sweetie pie. go. So that SI joint was a little tender in extension. So I'm going to check this SI joint over here in flexion and see if she's also tender on this side going the opposite way. And the reason I'm checking this in the opposite direction is because that's how the pelvis moves. One SI joint goes into flexion while the other goes into extension because of the way we walk. It's doing this. So this is the top of the pelvis, where I'm kind of feeling with my hand. And this would be her pubic symphysis. But for this demonstration, you can just assume that these are her legs, right? So as one side of the SI joint comes up and back, the leg comes forward. When that happens, the other side of the pelvis goes down and forward and the leg goes back. So we're walking like this. When I'm checking those SI joints, I'm basically checking that when she moves that leg forward, that the SI joint is freely moving backwards and down, called PI. And when she brings that other side backwards, I'm checking that the SI joint's going AS, anterior superior, basically coming forward. So that's why I'm checking the other side going the opposite direction, because if she's stiff and tight going into extension here, then she's probably going to be stiff and tight going into flexion on the other side. That's just how those biomechanics work. Unless we have an issue, what's called the sacral base. If the sacral base is in position correctly, then it can affect both SI joints in the same direction. But I feel like that's pretty rare. So I don't usually go to look at that unless both sides are sensitive in the same, or tight going in the same direction, which they're absolutely not. So good girl. Oh, good girl. I'm gonna wait for her to move that right foot. There we go. As soon as she moves that right foot and sets it down, boom, that's when I do the adjustment on the other side. That's a good girl. That's a good girl. You're so good. You're so good. Oh. She's so dang sweet. I could spend hours with her. Thanks, Cindy. Yes, please, guys. If you're enjoying the live, please hit that like button. I would greatly appreciate it. Kat would greatly appreciate it. Show her some love by hitting that like button, or just double tap your screen for me. Beautiful. That's what I like to see. Right there. So I see her about every 8 weeks, her and Marilyn back there. So I usually don't find a whole lot on them because they have maintenance adjustments every 2 months. And they get a lot of work. They're both barrel racers and they get ran a lot. They're getting run at the American Qualifier down in Tucson this weekend. So just doing a little tune-up on them before that. Good girl. All right, so I'm gonna check her range of motion in her neck, see if she can come touch my hand at her shoulder. That's beautiful. If you stick around when I adjust Marilyn back there, you'll see her when I do this. As soon as I go to put my foot into position, she goes around and touches the shoulder. I don't even have to reach around and touch. Cat knows what's coming, you know, and as soon as I do reach around and touch, she comes around. But Marilyn just anticipates it. As soon as I put my foot in position, she comes around and touches. It's pretty cool. Awesome. I don't know how many hands she is. She's not my horse. I would guess she's probably upper 15s, something like that. She's little. But her rider's little too, so doesn't need to be very big. Yeah, I always tell the horse owners when I see something like that. So it's kind of my responsibility when I go out, if I see anything out of the ordinary, to let the owners know. Because oftentimes, you know, they're at work or, you know, whatever they're doing, they're not there when I'm working. So it's good to let them know what I find. You know, for 2 reasons, right? Number one, obviously, you want them to take care of the problem, especially something like that. And number two, you never want to leave the situation open where they can have a thought like, is it something he did, right? So just go ahead and let them know every little thing you see, whether that be shoeing or hives or scratches or cuts or, you know, anything out of the ordinary, any pain they're feeling. All right, I'm gonna check her over here one more time. That's very good. Let's check, palpate her poll. A little tighter on the left side. Not bad. Let's see. Well, she's definitely not moving as good to the left. Watch. See, not as quick to go. She does get there. But if you watch the reaction time between that and this, it's a lot different. She actually looks a little stiffer to the right now that I look at it a second time. Like she's breaking over really nicely at the pole, but then when I'm asking her to rotate all the way around at the end, she's tight. And that usually means that she's stuck in the lower part of her neck here. Come on, everybody wants to see. Good girl. Right there. So I'm just gonna bring her around my hand, nice and easy. Good girl. Oh, that's good. And then she kind of tightens up, so that's what I want to see. I'm gonna pull her around, extend her a little bit. Oh, right there. Good girl. Beautiful. And I'll give her that for a second. Love the head shake. That's usually followed by some licking and chewing. Head staying nice and low. That's what I want to see. So this is Cat, and behind Cat we have Marilyn. Both awesome barrel racers. You know what? That's a good question, Cindy. I'm not 100% sure. I'll have to check my my notes and let you know. But I've been working on her for, gosh, 6 years probably now. It's been a while. So I'd guess she's maybe 11 or 12, somewhere in there. Yeah, she's just the sweetest. Love this horse. Eyes are kind of closing there. Super chill. It's what I love to see. I like to see their heads below their withers. Nice and relaxed. Awesome, guys. Hey, we got 100 people here and only 14 likes. If you guys could take a second, just hit that like button or just double tap your screen. I would really appreciate that. Lets me know you're liking the content. Lets YouTube know you're liking the content. And then they'll spread the word. So thank you so much. If you guys wouldn't mind doing that, I would really appreciate it. All right, I'm gonna put her head up into extension, put her on my shoulder. Good girl. Oh, good girl. She's kind of fighting that a little bit today. Oh. Ugh. Does that not feel too good? Huh? Oh, you're okay. You're okay, sweetie pie. Oh, you're all right. What's going on? Oh, good girl. So oftentimes when horses are fighting this one, oh, you're a good girl. Really what they're doing is showing you that that's not what they need. And oftentimes, you know, if I go to extend them like this and they're giving me a big fuss about it, instead of continuing to go up into extension, I'll go down towards their chest with it, and then I'll get a really big release at the pole. So a lot of times, like, people will go, oh man, she's fighting this or it's hurting. She needs that adjustment, right? But she's not fighting it necessarily because it hurts. Sometimes they fight it because it's like you're trying to move their head in a certain direction. That's fine, and they need you to move it in the other direction. It's kind of interesting, especially when you work on the same horse over and over. You start to get a feeling for their body language, and if you listen to that, then they really show you a lot of the times where they actually need to be adjusted, versus sitting there trying to fight them when they're fighting you and going, oh, you know, your ego's in the way, going, I got to get this adjusted, but it's actually not what they need, and then they get pissy, and then you get bit, or then you get kicked, or whatever. And I can't tell you how many times I've tried to extend a pole and it's not going, and I go the other way, and boom, you get a nice, easy release. So it's not like people where, you know, people aren't showing you what they need based on their body language. You know, people tend to fight and cringe in areas where they need to be adjusted, and horses tend to, you know, kind of fight and cringe when they don't need to be adjusted in those areas. So it's kind of backwards. So I'm going to bring her down to her chest. There. Oh, good. See, no fight on that. You got a really nice release. You got a little head shake. Oh, hi, sweetie pie. You're a good girl. You're a good girl. Huh? Yeah. Good girl. Such a sweetie pie. Whew, man. Tough crowd today. Come on, guys, hit that like button for me. Goodness. 17 likes out of 135 viewers. Come on, guys. Show Kat some love with that like button. All right, so let's get her legs done. I'm gonna bring this leg out first. And she kind of has a tendency to fight these, so I just go nice and slow. Usually stay kind of low on the shoulder abduction stretch, because she just, for whatever reason, doesn't tend to like this one. So I'm not gonna force her, I'm just gonna hold it and then kind of let her do the work. Good girl, see that? So I don't usually force that because, you know, the muscles you're stretching are the pec muscles, and the pec muscles go from the shoulder to the sternum. So if I pull that leg out and she's got some tightness in the sternum or inflammation, tightness in the pec muscles or inflammation near the sternum, you know, you can cause her to get really sore. And I definitely don't want to do that when she's about to run a big race on Saturday. So, you know, for the stretches, you want to stay within their comfort zone. You don't want to stretch it past where they're fighting. So that's what I do. I just kind of stretch to within their comfort zone. And then I kind of ask for a little bit more. That's good. And if they don't want it, then I back off. You're not going to hurt your horses by stretching them. But if they're sore, they've got a little pain somewhere, and while you're stretching them, they're fighting you, you know, that's a sign. You know, they're trying to show you that, hey, I don't want any more of that, or that hurts. And the last thing you want to do is make them worse, so you just back off a little bit. I have a whole stretching course on my website where you can learn how to stretch your horses. So if it's something that you're interested in, or you just want to get a little bit more educated about your horse's anatomy, just check out the link in the description, or you can go right to my website at sporthorsechiropractic.com. And I teach you how to stretch your entire horse's body. Whoa, good girl. And, you know, there's modifications needed sometimes based on your size or your horse's size. And I go through a lot of those modifications in my course. So have a look at that. And also, I put on stretching clinics. So if you have a bunch of people that want to get together and do a stretching clinic, I'm happy to do that as well. And you can reach out to me on my website at sporthorsechiropractic.com as well. Good girl. And you can see she's a lot more comfortable stretching the right shoulder than the left shoulder. Ironically, this is the side where she has a little tear from getting kicked by the bully back there. Good girl. She's so good. You're so good. Oh. Good girl. Really good, sweetie pie. All right, and Kat has huge releases in her hips almost every time. So when I go in her back legs, I'm going to spin her around so you can see that and hopefully hear some really nice releases that she'll have back there. If you guys have any questions while I'm working, please let me know. Yeah, she's she's a sweetheart. She loves her adjustments, and I love coming to see these two. That's not a dumb question. Everybody assumes that I own horses, but I don't. I mean, I don't really need to own them. I get, as much time with horses as I need, and people always invite me out to ride, so I can go ride and not pay the bills. So no need, but hopefully one day I will, and I really want to get into do some team roping, so that's my goal long term. Thank you, Montesi, appreciate it. I think she's around 12 years old or so, Alexis, not 100% sure. I'll have to check her file and see how old she is, but I think she's around there. All right, I'm gonna push her back a touch after she got a little bite of that breakfast. I'm just gonna do her setup like this. I think you guys have a good view of this right here. And she wants to take another bite, so that's all right. All right, let's bring her leg up here. Good girl. All right, so I'm just gonna bring that leg straight up. Good girl. This is a good flexion stretch for all the posterior muscles of the pelvis. And I teach you how to do this in my stretching masterclass. I do not teach you how to do the adjustment, just the stretches. Good girl. That was good. That's good. Good girl. Good girl. All right, I'm gonna pull her a little bit forward. Okay, good girl, right there. Oh, good girl. Thank you, Jezjin. All righty, Samuel. Oh, I love them. I mean, I love the burros. BLM Mustangs just depends on what you get. There's specific herds that you don't want to rescue from, and other herds that have different personalities that are better. Just kind of depends on what you want to do. If you're interested in getting a burro or a BLM horse, Cindy, for real, let me know. I've got some really good contacts for you that you could reach out to. People that rescue them and then they halter break them, and sometimes they'll saddle break them. It just depends on what you want, but they'll get them safe for you to handle, and then you can take them the rest of the way if you want. I don't ever recommend people, that don't have a lot of horse experience. Not saying that you don't, but if you don't have a lot of horse experience, you should not get Mustangs. They're a different breed. You really need to know what you're doing with them. But yeah, just let me know. I can put you in contact with the right people. That's Marilyn back there. I'll be working on her in just a second after I get Cat finished up. What are you doing? Trying to bite my butt? All right, let's see. All right. Oh. And this stretch right here, this pelvic flexion move is great because when you bring their leg all the way up like that, it causes the lumbar vertebrae to rotate towards the other side. So just by bringing that leg up, you can get some really good rotation in the low back. The lumbars are primarily an area of flexion and extension, but there is some rotation that goes on back there. And so just by bringing that leg up, you can make sure that she's free and clear to rotate both directions. Obviously, you got to do it with both legs. All right. Oh, really nice. Hopefully you guys could hear that one. Big release in that hip. Oh, thank you, Natasha. Yeah, we'll go see Marilyn here in a second. I'm just gonna stretch Cat's TMJs out, and then we will head over there. Whew. Marilyn, everyone loves Marilyn. I mean, everyone loves Cat too. But Marilyn has a freeze brand on her cheek. And so everyone's like, oh my God, I can't believe I can't believe that she's branded on her face. Owner should get branded on her face and blah, 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 blah. And people don't understand that a freeze brand isn't painful and that people will only freeze brand their horses in that spot if they're already branded on both shoulders and both hips, which Marilyn is. So don't get upset. She loves these horses like they're her children. I mean, they get adjusted every 2 months, and look how sweet they are. So, but I'll show you that here in just a second. But Marilyn's awesome. Marilyn's more of a, she's more of a, like, you know, don't touch me, just let me work type of a mare. But she does love her adjustments. Just initially, she can be kind of like don't touch me. And then she's like, oh, okay, go ahead and touch me. Oh boy. Let me just tie this up for a second. I'm gonna put Kat's fly mask back on her. Sorry, I don't mean to make you guys motion sick over there. I'm gonna put her fly mask back on, and then we'll go get started on Marilyn. Hey girl. Doot, doot, doot. So Kat's running in the All-American on Saturday. She's gonna go do her owner and her chiropractor proud. All right, let's close her up. All right. Oh, actually, I gotta lock Kat in because if I don't lock her in, she's gonna play with her lock and bust out. So she's stuck. Awesome, guys. Thank you for hitting that like button. I really appreciate that. If you don't mind doing it while I'm getting Marilyn set up, I would really appreciate that. Looks like we got 200 people in the live and 37 likes, so we can definitely add a few more there if you don't mind. All right, Miss Peep and Tom, you ready? I always get the feeling from Marilyn like she's sitting there watching me work on Kat like, hey dude, when's my turn? She has her nose right into the camera. Awesome. Why do doctors have so many issues with chiropractors? Because, I mean, I think it's multifaceted. You know, I think there's many reasons why they have issues with us. Some of it's our own fault. Some of it's the fault of the American Medical Association. But, you know, there's many reasons for it. I think back in the day, like when chiropractic first started, you know, so many chiropractors were saying that chiropractic cures all these different illnesses, you know. And diagnosing and treating illnesses is the job of medicine. It's not the job of chiropractors. Like when you get adjusted, the main purpose of getting adjusted is to clear the nervous system, right? So your body can function better. And when the body can function better, it's better equipped to handle stress. It's better equipped to heal, right? It's better equipped to fight off disease. And so, you know, some people will get better from certain things you wouldn't expect when they get adjusted. It's like when in my human practice, when people would be sick, right? When they would be sick, right? They would have a cold or a flu or something like that. They're like, hey, I'm not coming in today because, you know, I'm not feeling well or I'm under the weather. I'm like, hey, that's the time you need to come in. You know, come in, get your atlas cleared out, get your nervous system cleared out. You know, let your body be able to adapt and fight off whatever you're dealing with. But I would never say that I'm going to heal your cold or your flu with an adjustment. And back in the day, there were some people going, hey, you know, chiropractic can cure cancer and chiropractic can cure all this crazy stuff. And of course, that's going to piss off the AMA and the medical profession. But, you know, as we've gone along, you know, the medical profession has become great referral sources for us because a lot of doctors now are trying to prevent their patients from having surgeries and things like that. So if a patient's dealing with back pain, a lot of docs will refer to chiropractors to see if we can help them before they make that final decision to go into surgery. But as far as them not getting along with us, I think now that's more ego than anything. You know, there's not really a scientific basis for MDs to not like us. And even the American Medical Association now says that chiropractors are great at helping correct back and neck pain, which they wouldn't have admitted before. So we're making strides. I think in the animal world, you know, when you're talking about veterinarians, I think the reason that, you know, vets won't refer, or if vets don't like us, it's because, you know, it's just a money issue, right? If I'm able to keep horses feeling good and moving good, and I prevent them from needing veterinary intervention like injections, then of course they're not going to like that. So, but most veterinarians are phenomenal. I get a lot of referrals from veterinarians, so it's definitely not the norm where they won't refer to us. I think veterinarians refer to us a lot more than medical doctors refer to us, and I have great relationship with the veterinarians, but the ones that don't, they're either super old school and they just don't want to open their minds to it, or it's like, hey, you know, I don't want to lose money to another profession, so they won't make the referral. But the vast majority of them do, and they're great. Hey, Tink, good morning. This is Marilyn. It's a she. 18, 19 o'clock. I don't know what that means. Thank you, Veronica. I agree. Come on, guys, smash that like button for me. Hopefully we can get over 100 before I finish up with Marilyn. Hi, sweetie. All right, so let's check out the red mare. So these two horses, initially when I first worked on them, were the epitome of red mare, gray mare, right? You can see Marilyn's got a little bit more of an attitude, a little more personality, more demonstrative right off the bat. Cat's just like, okay, do whatever you want. You know, Marilyn can get a little nippy. Like, she's never bit me, but, you know, she'll kind of come around and give me the little, like, little chomps with the teeth, but never trying to get me. But she's definitely more, definitely more boisterous, definitely more sensitive than Cat is. Marilyn really hates the flies. Cat didn't care less. Oh. So I'm just gonna laterally flex her pelvis here. Make sure she's nice and comfortable. And then I'm gonna check her going the other way as well. Oh. Yeah, Marilyn's a little peeping Tom because whenever I'm working on Cat, she's always standing here staring. Yeah, I mean, the recommendation from your brother is, you know, it's probably his actual opinion, but 24 hours. I mean, that's kind of a random number, right? I mean, we say 24 hours because 24 hours is a day, but what scientific evidence do we have to suggest that you need to wait 24 hours, which is a man-made number, right? We just arbitrarily said there's 24 hours in a day, and all of a sudden that becomes a recommendation without any scientific basis, you know? The one thing that that I think might be where he gets that 24 hours is because whenever you have a significant injury that requires an x-ray, you should wait 24, you sometimes need to wait 24 hours after the injury because there's so much inflammation at the site of the injury that it'll block the x-ray and you can't see small hairline fractures. So a lot of times they'll recommend, even if you go to the urgent care and get an x-ray, if you don't see a fracture, you might want to wait 24 hours and then go get another x-ray to make sure that nothing was missed. So that might be where that was coming from. But, you know, certain injuries, obviously you don't have to wait 24 hours. You know, it just behooves you if you think there's a fracture because, you know, then you won't need to get 2 x-rays, you just need to get 1. Back. Yeah, I mean, and different chiropractors do different things. You know, there's good ones and bad ones, just like anything else. So you may have just gotten a bad one, or he might not have been the right guy to go to, because some chiropractors focus on sports injuries and injuries in general, while others just focus on maintaining the spine and being more of a vitalistic chiropractic office where they're just trying to help you move good and function better and not necessarily fix your problems. Yeah, I mean, that could very well be the case. I mean, we've all had bad ones, but we've all had bad everything, right? We've had bad MDs, bad dentists. You just go find another one. That's a good girl. All right, so I'm gonna hit her pelvic flexion pressure points, bring her pelvis up and her back up. Oh, just like this. Woo, there we go. Nice little releases in that low back. Good boy, good girl. Good boy, I'm sorry. I'm sorry, I know you're a girl. Come on. I won't get political with the good girl, good boy thing either. Pardon me. All right. 52 likes, 150 viewers. Thank you guys, appreciate that. All right, let's bring her down into extension. There we go, that's good. Oh. After this, I'm gonna go to another client who's a barrel racer. I won't be doing a live there, but then I have 4 horses, see? Then I have 4 horses to do at a rehab center, and hopefully I'll be able to go live with them. So you can see what she just did. That's what I was explaining when I was working on Cat, is that Marilyn will anticipate what I'm asking. So as soon as I put my foot up under her, she turns to the right because she knows that I'm gonna have her touch her shoulder, right? Now she didn't go all the way, nope. But all I gotta do is initiate the request and she comes right around. Same thing with the other side. Look, I'm not even there yet. And she's like, I know what you're gonna do. I'm gonna go touch this on my own. Look, watch. So some of these horses are so smart. That's just crazy. Exactly, thank you. Please like the live. That helps us out as creators so much you don't even know. So if you guys are enjoying the live, please just take a second and hit that like button. Thank you so much. Yeah, Stephanie, I mean, I get adjusted about once a week, and it helps me way more than anything else. If I have a headache or a migraine, I feel like I'm gonna get a migraine, which I don't really get, but if something's coming on, I'll just go get adjusted. If I have a head cold, I'll go get adjusted. Hey, good morning, Daniel. Thank you, Sophie. Yeah, she's a sweetie pie. What are you doing? What are you doing? Huh? All right, so one more time, boom, come touch the shoulder. You're a good girl. Look. Good girl. I mean, if they rotate around and touch the shoulder that easily, there's really nothing else to check as far as rotation and then the neck goes. And usually if they move correctly to the shoulder like she does, then there's really nothing in the pole either. But I still like to get my hands on the pole, just verify that there's no pain or discomfort up here. Because if there is, this can really affect their movement very negatively. So I just want to make sure she's comfy. Oh, good girl. Oh, I gotcha. I gotcha. I gotcha, sweetie pie. Good girl. Staring into my soul right now. Good girl. Oh, good girl. You're okay. You're okay. Good girl. Let's stretch this out. Oh. She timed me just perfectly. As soon as I went to put my hand up there, she's like, nope. Good girl. Oh, yeah. Nice. Oh, big shake, big lick. Good girl. Oh, big shakes. Big shakes, huh? Oh, yeah. See her stomping her feet and biting at her shoulders. She's just super sensitive to those flies. Thank you, Marcy. Glad to see you as well. Good girl. Good girl. All right, let's get her legs done. Oh, oh, very good, sweetie pie. Oh, there we go. Whew. Wow. You got 2 shoulder releases and 1 nice release in the wrist just by doing that. Oh, it's a good girl. Yes, I said wrist. Oh my gosh. What do you mean horses have wrists? Well, horses have shoulders, right? Horses have elbows right here. So is it shoulder, elbow, knee? Shoulder, elbow, nope. Shoulder, elbow, wrist. This is actually called a wrist in veterinarian terminology. We call it a carpus, which means wrist in Latin. But we say that horses have 4 legs. So because we say they have 4 legs, we call that joint by the wrong name. We call it a knee. But even if you look at it under an x-ray, it has no resemblance to a knee whatsoever. It looks very much like our wrist, except in our wrist, we have 2 rows of 4 carpal bones for a total of 8. And then they have 2 rows of 3 carpal bones, and then they have 1 carpal bone on the what we would call the caudal side of their wrist. It's called the accessory carpal bone. So they have 7. So we have 8, they have 7. Then they have an ulna here, and they have 1 metacarpal bone, which is the cannon bone, right? This is the metacarpal right here, the cannon bone. We have 5 metacarpal bones, and they only have 1, right? So they have 7 wrist bones. They've got 8 with the metacarpal and 9 with the ulna. Where we have 8 carpal bones, we've got 5, right, with the metacarpal bones, so that's 13. Plus we have the radius and ulna, which is 15. So they've got 9 bones, we've got 15 bones. 15 bones make up more joints than 9. So we've got more range of motion in our wrists than they do, but they can still do circumduction, ulnar and radial deviation, even though they don't have a radius. And then they can do flexion and extension as well. So you got to make sure that all those movements are clear in their wrists. Hello, Sharath. Chapstick. I need chapstick? I don't think so. My lips don't feel too dry. Lavesh, this is a mare. It's a she. Sounds good, Zana. Can you tell me how to say your name? Can you tell me, just type it out in there, what's the correct I can't talk. What's the correct pronunciation? Her name is Marilyn. All right, so let's get Marilyn's back legs done. See what we get here. Let's see if we can spin her around, give you a little bit better view of her rear end and these hind leg adjustments. Good girl. Go back. Good girl. There we go. That's good. That's good. She's so good. I love this mare. All right, let's go. I wish Marilyn and Kat could have 2-hour appointments because they're just so nice. They're just so nice to work on and so well behaved. They're super sweet. They're like my therapy horses, my therapy clients. Oh, there we go. Really nice release in that hip. Good girl. Good girl. Oh, good girl. So good. Can you step over? Good girl. Whoa. Good girl. Good girl. Oh, stand. They want to see you. They want to see your butt. Come on. Good girl, right there. Right there. Awesome. Oh. All right, let me turn this just a little bit. There we go. Let's get this side done. Perfect. Good girl. Good girl. There we go. Oh, beautiful. So whenever you're dealing with the legs, whether it's stretching or adjusting or motion palpating, you just want to go nice and slow. You know, if you go too quick, they can't get their balance or they can't maintain their balance. And so they're just going to be kind of wobbling all over the place. They might pull the leg away from you so they can set it down. If they're sore on the other side and you're causing them to bear all their weight over there and they get painful, you know, you might set up for a little bit of a dangerous situation. And, you know, they can get sore in their hocks or in their stifles or in their hips or in their SI joint. So there's many different areas in their lower legs where they can be in discomfort. And so you just want to make sure that whatever you're doing in the back legs isn't going to cause them to have this sudden pain or to hurt. So just go nice and slow. Allow them to show you that something is uncomfortable before they, you know, really have to overreact to get that leg away. Just keeps everything nice and safe. All right. And again, if you guys want to check out the equine stretching course on my website, you can find that link in the description on this live. You can also just go directly to my website at sporthorsechiropractic.com. No, brands don't fade away. I mean, if it's a bad brand, especially if it's a heat brand, but it can happen with freeze brands too. If they don't kill all the follicles, then you can have hair grow out and then it makes the brand look like trash. So, but they don't fade. No, those are fly boots. So they just keep the flies off their lower legs so they don't sit there and stomp all day. Oh, that's also a Reen boy. Good luck. Xana. Okay, cool. Thank you, Xana. Yeah, she is so good. Awesome, guys. Hey, we have double the amount of people in here that we have likes. I'm gonna put the halter away, excuse me, and put her fly mask on, and then I gotta head over to my next stop. So if you guys don't mind hitting that like button for me before the end of the live, I would really appreciate that. I'm really trying to get my subscriber base up over 100,000. I think right now I'm at 89,000, just under 90. So the likes really help YouTube, or really helps to let YouTube know that you guys are enjoying the content. And then, you know, they'll help spread the word and spread my content around so more people get to see it. So if you could just take a quick second and double tap your screens or just hit that like button directly, I would greatly appreciate it, guys. Awesome. Well, we got one more out of that. Can't ask any more than that. So whoever has hit the like button, thank you so much. You know, it's greatly appreciated. Definitely helps keep us motivated to create more content when we get the likes and the shares and the comments and all the interaction. Sorry, let me just hook this up. So I really appreciate you guys being with me today and all the interacting. So thank you so much. I've worked on some horses out in Lexington, Kentucky, but they were all babies, really. They were all yearlings and weanlings that, you know, they just wanted to check them and make sure that everything was fine after the birthing process. And a couple of them had some known issues that they wanted me to work on, but I've never worked on any that ran in the Kentucky Derby. I was just over in Dubai in February, and I worked on a whole bunch of 5-star show jumpers, which are the cream of the crop. And those horses are worth, man, they can be worth in the millions of dollars. So I've definitely gotten to work on my share of amazing horses. And those videos, I think I posted some of those videos on YouTube, but they're definitely on my Instagram and my Facebook and my TikTok, and all of my socials are sport.horse.chiropractic. So if you're interested in taking a look at those, please do. But for now, I'm going to sign off and head to my next spot. Thank you guys so much for watching. Really appreciate it, and I hope you guys have a wonderful day. Minutes or so for 4 horses. So